Hi, welcome back. So now that you understand exactly what the 5-in-1 is and how you do it, what I'm going to do is turn it back over to Dr. Brian because he's going to explain to you why working and doing the 5-in-1 is so powerful at regulating your blood sugar, lowering insulin levels, and shifting your metabolism so that you are burning fat at a premium.
Thank
Dr.
you, Renee.
Brian?
Thanks, Renee. I really appreciate it. A lot of times patients ask, well, why is this different? And let's talk about that. I usually start with an example. And the best way to think about this is, let's say you don't eat breakfast in the morning and you actually go out and exercise. Well, the whole skipping meal thing is not very good. And let's talk about that. Let's say you actually do eat breakfast at 8, and then you exercise, and then you don't eat lunch again until noon. Well, about 2.5 hours, your body is saying, hey, your stomach, first of all, is empty. There's nothing in there. You may have had cereal, or you may have had even a little bit of protein, but by then, a lot of it's metabolized and it's in your system, it's gone. But the stomach sends very strong signals up to the brain that says, oh no, stop. There's nothing down here. So now, officially, you're in starvation mode. Are you really starving? Well, I'm going to tell you, some of my patients, when they have waist circumferences out to here, they are not starving. But their body perceives that they are starving. So what do? Well, if you're starving, where is the energy that you're asking, especially if you're mid-morning exercising, where is the energy coming from? Well, a little bit's going to come from the liver in the form of stored glycogen, from glucose, but the other part of it's going to mostly come from protein, from muscle. It's going to break down that muscle. And then you get into a situation on a daily basis where you're always breaking down and building up and breaking down and building up muscle. You're not really touching the stored fat. On the program where you're eating every 2.5 to 3 hours, what actually is happening is, since your stomach knows that there is food there, and it's getting every 2 to 3 hours you're getting food there in a proper portion-controlled meal replacement, carb, fat, protein, then it knows right from the get-go that it's going to happen. So what happens when it demands energy? Where's it coming from? It's coming from the protein, or is it coming from the fat? It's coming from the fat, of course. And it begins to break down that fat, but more so, since you're always doing this, and it goes back to my mom's story. I remember that when she first went on the program, one of our coaches, she called one of her coach, because I certainly was not my mother's coach, and she called the coach and said, Susan, I had to set an alarm clock to take that last replacement. And the truth is, it is difficult to get that 5th replacement in if you do not start quite early. Right. So, and so every 2.5, 3 hours, you have to be doing that. If you miss that 5th replacement, a lot of times you are not burning as efficiently, and you're not in that fat burning mode. Now, once you're in fat burning mode, you actually start losing fat. And that's important, and that differentiates from a lot of these other programs where, I tell people, forget it. You're not going to, and I'm sorry, Jenny Craig, but you are not going to lose weight eating lasagna. It's just not going to happen. Okay, and you're certainly not learning. You may lose a little weight, but you're going to be gaining it back. Right. Your body's not learning that habit of health, which is very, very important. That brings us to another very important subject, which is insulin. Well, insulin in the body, as you know, takes out sugar. Hyperinsulinemia, just recently in studies, has been shown to be linked to coronary artery disease. Who would have thought? Okay, it makes a lot of sense. It's stuff we've kind of known, but recent studies have really pointed us in that right direction. So high insulin levels not only are linked with coronary artery disease, but it's also linked with truncal obesity. Okay, this truncal obesity, or central adiposity, adipose is adipose tissue, or fat cells, if you will, these are very, very dangerous. And in fact, when I get my patients that come in and they say, I'm overweight, and I look at them and their waist circumference is normal, I say, yeah, you could go on this for optimal health. But you really don't have a lot of weight to lose, but you really need to optimize. So you need to learn how to eat better. And then we talk about nutrition and we talk about eating better. But I'm not so concerned with their weight if their waist circumference is normal. Now, speaking more of insulin, insulin is also a growth factor. So if you have high insulin levels, you're going to continue to grow this. So as Dr. Anderson points out in his Habits of Health in the book, the glucose insulin curve, you want it to go from this breakfast, lunch, dinner. If you have a graph curve, I'm sorry for our viewers. You want it to look more like this. You want it to be very, very low. And you certainly, as a nutritionist, dealt with a lot of diabetics, and we saw this all the time. Now, a lot of my diabetics that we're putting on the program, we are very, very quickly taking their insulin levels and driving them much lower. Because, I mean, by day 7, day 8, they are not feeling well. And they're not feeling well because they're being over-treated with either their medicines or their insulins. So physician involvement, I believe, is very, very critical and very, very important for understanding the hyperinsulinemia, very important for understanding the skipping of meals, and very important in understanding the meal replacements.
Absolutely. Oh, so beautifully said. And you know, I like to say, Dr. Brian, that we use food like a drug anyway.
It's the most powerful drug we have.
Exactly. And every day we're eating or consuming this drug. So we can either use this drug to give us very positive benefits or negative. And when you use Take Shape for Life and you're using this perfectly balanced food, you are using it as a very powerful drug to help drop that insulin level back down into a much more normal, healthy state. And when that happens, not only do you begin to burn your body fat for energy while maintaining muscle mass, but you also really affect internal inflammation in the body. And we now know that internal inflammation is a huge critical cause of so many...
On many different levels.
On many different levels. So if you are somebody who is suffering from any kind of coronary heart disease, joint issues, arthritis is very positively affected in this way.
Renee, this is the first time, this past year has been phenomenal for beginning to get people off their medicine. I feel like a lot of times with my patients that we're dealing with optimal health, we're really moving them towards getting off a lot of their medicines. Not everybody, but we could tell story after story. And in our testimonial section, we'll talk a little bit about some of these patients that have done very, very well.
Thank you so much, and we'll stop this at this point. Thanks.